My name is Monica Keller. This presentation is about atherosclerosis. The objective is to discuss this disease background, demonstrate pathophysiology of this disease process, identify diagnostic tests and treatments for this disease, and discuss genetics, environment, and lifestyle risk factors of this disease. There are usually no signs and symptoms until complications occur, such as a heart attack or a stroke, in which arteries in the heart or the brain have been blocked due to plaque buildup. Comorbidities would include carotid artery disease, in which the vessels in the neck, the arteries in the neck, are not functioning appropriately due to blockage. Peripheral artery disease, in which those arteries have been blocked in the arms and legs. And then chronic kidney disease, and those arteries within the kidneys have been blocked, and they're not able to the kidneys aren't able to filter and remove excess fluid or waste as they're supposed to. Pathophysiology of this disease process in this video shows the normal cardiac function prior to atherosclerosis, and then the abnormal function of the heart after atherosclerosis. You can see where the blood is not getting through the vessel well due to a blockage, and as that blockage becomes bigger, the blood flow stops altogether within that artery. The first part of the video, you saw how the heart was pumping as it should, and here on this part of the video, you can see how the heart isn't pumping as well, which means circulation would be poor throughout the body due to that blockage. Diagnostic test and treatment. Diagnostic tests include blood tests, EKG, chest x-ray, ankle brachial index. They can take the blood pressure in the ankle and also the brachial artery to see the blood flow. Echocardiogram, our graph that shows a picture of the heart. Well, basically it shows movement of the heart with sound waves. CT scan, you can get you can see narrowing of arteries within the brain and the heart. The stress test that gives an increased demand of oxygen on the heart, which will allow you to know whether or not there's possible narrowing if that oxygen demand is not met. And then an angiograph that basically includes the doctor injecting dye into the arteries so that they can visualize the arteries. Treatment could be a percutaneous coronary intervention, where they can put balloons into the vessel, open those balloons, and move that plaque to the side so that it can increase flow. Coronary artery bypass grafting, that basically is where they take one artery and bypass that artery that is narrowing so that you can get better oxygen or blood flow to that area. Carotid endarterectomy is where they actually go in and remove plaque from the carotid arteries within the neck. And then the medicine mostly used for this type of disease is statins, because that helps with lowering the cholesterol within the blood level, which is one of the main reasons that there is plaque buildup causing atherosclerosis. Genetics, environment, and lifestyle risk for atherosclerosis. There is a strong family history of high cholesterol, which is one of the risk factors for this disease. I know within my family, on my maternal side, all the women tend to have high cholesterol regardless of our diet, exercise, things of that sort. It is hereditary. Obesity is also one of the factors that can cause issues with plaque buildup, as well as physical activity. You don't want to have obesity, limited physical activity, and then also poor eating habits. So foods that are high in cholesterol, high in fat, all of those things contribute to developing atherosclerosis, as well as age, because it is also known as hardening of the arteries. It happens over time. It's something that happens with age that cannot be prevented. But the things that you can prevent, of course, would be obesity, your activity level, as well as your eating habits. thank you for listening to the presentation. These are references used within the presentation, and I hope you enjoyed. Thank you.